So low vitamin D, of course, we talked about it in the context of rickets. Um, there's a lot of really interesting research out there. Some studies that have proposed that it's correlated with reduced insulin response, cardiovascular disease risk, um, coronary issues, heart issues, blood pressure, stuff like that. And part of the problem um, I think in the vitamin D research right now is a lot of these studies go into whether or not the patient's on supplements. Like if a patient's on vitamin D supplement, does it make them more at a higher risk or a lower risk for developing some type of disease? And the problem is we don't get most of our vitamin D from vitamin D supplements. We get it from sunlight. So you can have a patient that even if you've got a double-blind controlled study where this half of your patients, they're on the supplements and this half aren't, it's not like you're monitoring their everyday activity, counting the number of minutes they spend out of the sun. So if you've got a bunch of people in your control group that are spending a lot of time at the beach, it doesn't matter that they're not on a vitamin D supplement. They might have a higher vitamin D level than the patients that are on the vitamin D supplements. And then to make it even more complicated, you're trying to do a double-blind study, but what you really want to be doing is measuring everyone's vitamin D levels to see if it correlates with anything. And once you start measuring everyone's vitamin D levels, then it's no longer a double-blind study, is it? Because now everyone knows what their vitamin D level is. So I think it's one of the challenges. And I think that's a problem in nutritional studies in general, because you really can't do them in the classic double-blind style that you want to, because at the end of the day, someone has to measure that value and know what their vitamin D level or their vitamin E level is. Let's see, high vitamin D. I've seen a few cases of vitamin D overdose of kids getting into the medicine cabinet or something like that. Long-term vitamin D toxicity, that's where you'll get that calcification of the soft tissue as calcium starts building up in weird places it shouldn't be building up in. Short-term, your typical poisoning type, fatigue, nausea, anorexia, diarrhea, gastrointestinal issues. So yeah, rickets is your classic vitamin D deficiency disorder, right? And you can see the bowed legs there from improper bone formation. Bone softening as a result of low calcium levels as a result of vitamin D deficiency. Some of the other things that you might see along with it: elevated blood pressure, links to colon cancer, breast cancer, and a few others. Here's a X-ray. You can see the bowed legs there. This was observed since ancient times. And this is, like I mentioned, this is kind of where the origin of labeling vitamin D as a vitamin rather than a hormone came in, because they found that cod liver oil was the cure for this. A couple centuries ago, it became known as English disease. Anyone know why was it called rickets? Why it was called English disease? Yeah, because it got really smoggy and everyone was indoors around England, and it was developing in kids then. And I forget who it was, which doctor noticed that, because there was a guy who was doing medical work around the world, and rickets was all in England. It wasn't in Japan. And he was like, well, what's the difference between Japan and why is Japan there's no English disease, and in England there's English disease? So it's stuff like that. I think at one point someone didn't the way they figured out it came from UV light, from sunlight, is they actually, I think they had like kids that were living in caves or something like that, and like with no sunlight exposure, and they observed rickets in them, and they realized that if you shine UV light on them, it cures, even if you're not shining the UV light on the right part of the body, like just any part of the body. Like they've got the legs that are deformed, you shine the UV light on their arms and it cures the rickets given enough time. who comes up with those kinds of experiments? I don't know. I can't imagine those would be like IRB approval nowadays for yeah, we're gonna have a bunch of kids that live in caves. And we're gonna shine UV light on them and see. Yeah, there's. Let's see. If you've got a nutritional deficiency, um, you want to, in the short, immediate term, be giving tens of thousands of units per week for maybe a couple months. Your typical vitamin D daily supplement gummy or whatever is probably going to have about 1,000 units in each one. Now, I have seen during the COVID time people going a little crazy with the vitamin D thing, because someone hears that it's a risk factor, and then they start going right. They go crazy with the with the vitamin D supplements. And one of the guys was like, "Yeah, this one guy was recommending vitamin D, but he's recommending like an entire bottle per day." I said, "No, that's probably too much." That's because vitamin D is active in the body through a multi-step process. If someone's got a liver disease or someone's got a kidney issue where you're not synthesizing the right vitamin D, it's not enough just to give your D2 or D3 supplement. You actually have to give the 25-hydroxy form or the 125-dihydroxy form in order to supplement, because this is the active form, this final form that actually matters. So if the kidneys are not functioning properly, it doesn't matter how much vitamin D you got in the diet, you need to give this active form of the hormone in order to produce the desired effect. For acute COVID-19 cases that I've seen treatments for, I've seen people hospitals giving the 25-hydroxy form with levels that are comparable to this, tens of thousands worth of units over the span of days. And that drastically reduced mortality. I think that research was done in Spain. I was looking at that a couple months ago. And so giving tens of thousands of units of the 25-hydroxy form to patients that were looking to be in bad shape, it completely eliminated mortality in those patients. It was something like 100% reduction in mortality in them. It was ridiculous. I've seen other studies that have tried supplementing with just the regular D2 or D3 as a potential treatment. The thing is, this process, if we go back here, this process is like a week-long process. So it's not like you can just give someone a ton of D2 and D3 right off the bat, and then within a matter of hours, they're going to have produced the 25-hydroxy form. It takes about a week for increased uptake of D2 and D3 to correlate into elevated levels of your active form of vitamin D. But you give it the 25-hydroxy form, it's much more of a quick burst. It gets to activity much faster. Vitamin D excess, if you go crazy with the gummies, some symptoms: confusion, increased urination, increased thirst, anorexia, vomiting, muscle weakness, bone demineralization because it's facilitating parathyroid hormone activity, calcium and phosphate building up in different tissues, causing it problems like that. It's pretty nasty stuff. Very rare, though. You're not going to run into that very often. We're much more going to be vitamin D deficient. And yeah, just another picture of the role here. So you can see vitamin D synthesized in the skin or consumed in the diet, converted in 25-hydroxy form in the liver. Converted parathyroid hormone is facilitating its conversion to the 125-hydroxy form in the kidneys there, and then that is producing the effect of increasing serum calcium to facilitate good bone growth and overall neuromuscular activity.